Welcome to Vision Disorders in Children. In this module, we will briefly describe common childhood vision disorders. In this module, you will learn to describe some of the common childhood vision disorders, to explain the consequences of failing to detect these disorders at an early age, and finally, to explain the role of vision screening in detecting vision disorders. The first vision disorder we will discuss is amblyopia. Amblyopia, commonly known as lazy eye, is a vision disorder resulting in decreased vision in one or both eyes due to insufficient visual stimulation of the brain in early childhood. Around 2 to 5% of children have amblyopia. Amblyopia can be caused by misaligned eyes, a condition known as strabismus, refractive errors, such that one eye is more nearsighted or farsighted, or an obstacle blocking visual stimulation to the eye, such as cataracts or a droopy eyelid, also known as ptosis. The good news? This disorder can be easily treated at a low cost if caught early. Treatment options include prescription eyeglasses, or patching the better eye by using an adhesive patch, or by using atropine eye drops, forcing the brain to use the weaker eye. However, as development of the visual pathways slows down as the child gets older, treatment becomes more difficult. This is why early vision screening and detection is critical to prevent amblyopia. Strabismus, commonly known as cross-eyed, is a vision disorder in which one or both eyes are not properly aligned when focusing on an object, and the eye can turn in, out, up, or down. It is typically caused by poor eye muscle control, and the symptoms can sometimes be subtle. Symptoms may include decreased vision, decreased depth perception, eye strain, headaches, and double vision. As children's eyes develop, to avoid double vision, the brain will ignore the image from the affected eye, and over time the eye may become amblyopic. Without treatment, the condition can worsen but can be corrected if treated early, with treatment options including eyeglasses, patching the better eye exercises, and surgery if required. Finally, we'll talk about refractive errors, a vision disorder in which the shape of the eye prevents a focused image from forming on the retina. In children, common refractive errors include myopia, also known as nearsightedness, in which distance images are blurry and close-up images can be seen clearly. Hyperopia, also known as farsightedness, in which close-up images are blurry and distant images can be seen clearly. Astigmatism, in which images are blurry and stretched out. And isometropia, in which there is a difference in refractive error between the two eyes. This can lead to amblyopia. Treatment options include eyeglasses and contact lenses. It is worth understanding the role of vision screening in detecting the visual disorders that we discussed throughout the module. Vision screening is not a diagnostic procedure. Visual disorders are diagnosed and treatment recommendations are only made by eye care professionals such as optometrists and ophthalmologists. This is why we specify on the pass-refer criteria that vision screening does not replace a comprehensive eye examination. Even if a child does pass, we recommend a visit to the optometrist within 1 year. This concludes the module, Vision Disorders in Children. In this module, we learned to describe childhood vision disorders such as amblyopia, strabismus, and refractive errors. These disorders can lead to permanent vision loss if not corrected at an early age. Vision screening is not a diagnostic procedure, but rather is used to flag children who should see an optometrist where a diagnosis and treatment recommendation can be made.